Hello everyone, I am Dr. Vinayak Munirathnam. I work as a senior consultant in medical oncology at Shankara Cancer Hospitals here at Bangalore. So today is the World Brain Day. So let us discuss a little bit about the commonest brain tumors, how they occur and what are the symptoms and how do we treat them. So I would be telling on these lines in brief. So coming to brain tumors, one thing about brain tumors is it is not that very common among the cancers, but then it is also not that very uncommon. So we do get brain tumors. So these tumors can be cancerous or malignant brain tumors, or they can be benign brain tumors. Mainly a tumor is a collection of abnormal cells within the brain. Now brain being a closed cavity, the space there is very restricted. So any lesion there or any abnormal growth of cells in the brain would very soon lead to symptoms, and it can also mean to be life-threatening at times. Coming to malignant brain tumors, so malignant brain tumors can be primary or secondary. The primary ones are the ones which start from the brain. So they start from the glial tissue, that is the brain tissue, or it could be from the nerve cells, or it could be from the glands which are there, for example like the pituitary gland. So these are all primary brain tumors. Now the secondary brain tumors are the tumors which are there elsewhere in the body, for example like breast cancer, lung cancer, renal cell carcinomas, melanomas, that is from the skin. So these tumors can also eventually spread to the brain. So that is a metastatic lesion, so that becomes a secondary brain tumor. The area which it is compressing upon, so the patient can have slurred speech, the patient can have some weakness, swallowing difficulties, difficulty in vision, or a constant headache, and headache which happens early in the mornings, or headache which worsens when he sneezes, when he coughs, when he exercises. So these are the commonest symptoms, and the symptom depends, as I mentioned, it depends on the size where it is and the area which it compresses upon. So based on these symptoms, we suspect that there could be probably something happening in the brain. So to diagnose, we usually do a scan. It could be an MRI, it could be a CT scan. So based on the scans, we diagnose them, and if we have to know what the lesion is, if it is resectable, meaning if the surgeon can go ahead and remove the lesion, we would prefer to remove the lesion in toto. If not, then they would at least take a piece of the lesion, that is they would do a biopsy to know what the lesion is, and based on the lesion we decide upon the treatment. Now treatment of brain tumors, as I said, if it is resectable, primary treatment would be surgery. If not, then we would probably consider radiation or even chemotherapy in high doses. So these are few of the modalities we use to treat the brain tumors. So as I said, just as an awareness, I would want to say that these tumors are extremely uncommon, but the symptoms which I mentioned, if at all somebody goes through these symptoms and they stay for a long time, then it is always better to be aware and then get themselves investigated. And early investigation, and earlier we pick up the lesions, it is most often curable. So that is why awareness among these tumors is always important.